Pulmonary embolism is an cardiovascular disease. Look at this picture, shows that blocks in pulmonary artery. Look at this. CT findings, ECG variations, and MRI findings. Detail going on. Introduction. Pulmonary embolism is a potentially life-threatening condition that occurs when blood clot or embols blocks one or more arteries in the lungs. The blockage typically originates from a clot in the deep veins of the lungs. Deep vein thrombosis and travels to the lungs. PE is a medical emergency that requires prompt diagnosis and treatment. Definition. Pulmonary embolism is the obstruction of a pulmonary artery or one of its branches by material, usually a blood clot, that has travelled through the bloodstream from elsewhere in the body, most commonly from the deep veins of the lungs or pelvis. Types. 1. Acute PE. Symptoms develops suddenly and requires immediate medical intervention. 2. Chronic PE. Recurrent small emboli cause chronic symptoms and can lead to pulmonary hypertension. 3. Massive PE involves large clots, often causing significant hemodynamic compromise and shock. 4. Submassive PE, moderate sized clots that cause some right ventricular dysfunction but not full shock. Causes. The most common cause of pulmonary embolism is a deep vein thrombosis, where blood clots from in the deep veins of the lungs or pelvis and then break free and travel to the lungs. Other causes may include: 1. Fat embolism. Fat globules from fractures of long bones, example femur. To air embolism, air bulbs, often from medical procedures. 3. Amniotic fluid embolism occurs during or after childbirth when amniotic fluid enters the bloodstream. 4. Tumor embolism. Fragments of cancerous tissue. Risk factors. 1. Immobility. Long periods of inactivity such as prolonged bed rest or long haul flights increase the risk of clot formation. 2. Surgery, especially orthopedic surgeries like hip or knee replacements. 3. Cancer. Certain types of cancer and cancer treatments increase clotting risk. Four, pregnancy. Hormonal changes and reduced blood flow from pressure on the pelvic veins. 5. Contraceptive pills and hormone replacement therapy. Estrogen can increase blood clotting. 6. Inherited clotting disorders. Conditions such as factor 5 iodine or prothrombin gene mutation. 7. Obesity. Excess weight increases pressure on the veins, especially in the lower limbs. 8. Smoking. Damage blood vessels and increase clotting risk. 9. Heart disease, particularly arterial fibrillation, which can cause blood stasis in the heart chambers. 10. Pregnancy. Hormonal changes and reduced blood flow from pressure on the pelvic veins. 11. Contraceptive pills and hormone replacement therapy. Estrogen can increase blood clotting. 11. Inherited clotting disorders. Conditions such as factor 5 iodine or prothrombin gene mutation. 12. Obesity. Excess weight increases pressure on the veins, especially in the lower limbs. 13. Smoking damages blood vessels and increases clotting risk. 14. Heart disease, particularly arterial fibrillation, which can cause blood stasis in the heart chambers. Complications. 1. Pulmonary infarction, lung tissue death due to lack of blood supply. 2. Right side heart failure. Large emboli can strain the right ventricle, leading to heart failure. 13. Pulmonary hypertension, persistent high blood pressure in the pulmonary arteries due to chronic PE. 4. Sudden death, large untreated emboli can result in cardiac arrest. Pathophysiology. Pulmonary embolism occurs when a blood clot usually originating from the deep veins of the leg DVT travels to and lodges in the pulmonary arteries, obstructing blood flow to the lungs. The blockage creates a ventilation-perfusion mismatch, leading to hypoxia and increased pulmonary artery pressure, which strains the right ventricle of the heart. If untreated, it can result in right heart failure and decreased cardiac output, and particularly fatal systemic effects like shock. The pathophysiology of pulmonary embolism involves several steps, from the formation of blood clot to the potential consequences in the lungs and heart. Below is a detailed step-by-step explanation. First step: thrombus formation. 2. Embolization. 3. Pulmonary artery obstruction. 4. Ventilation perfusion BQ mismatch. 5. Increased pulmonary vascular resistance. 6. Right ventricular strain. 7. Decreased left ventricular output. 8. Hypoxia and lung tissue damage. 9. Inflammatory response. 10. Compensatory mechanisms. 11. Potential systemic effects. This step-by-step process highlights how a simple DVT can escalate into a life-threatening pulmonary embolism with significant respiratory and cardiovascular effects. Signs and symptoms. 1. Dyspnea, sudden onset of shortness of breath, is the most common symptom. 2. Chest pain, sharp stabbing pain, often worse on inspiration. 3. Cough may produce blood-struck sputum. 4. Trachypnea, rapid breathing. 5. Tachycardia, fast heart rate. 6. Hypoxia, low oxygen levels. 7. Syncope, fainting or near fainting episodes, especially in massive PE. 8. Cyanosis, brush discoloring of skin due to poor oxygenation. Diagnosis. 1. DMAT test. Elevated levels suggest increased clot formation, though not specific for PE. 2. CT pulmonary angiography, the most definitive imaging test, showing direct visualization of clots in the pulmonary arteries. 3. Ventilation perfusion scan identifies mismatches between air and blood flow in the lungs. 4. Doppler ultrasound used to detect deep vein thrombosis, often the source of PE. High ECG may show signs of right heart strain or ischemia, but is not diagnostic of PE. 6. Arterial blood gases, rebels, hypoxemia, and respiratory alkalosis. Nursing diagnosis: 1. Impaired gas exchange related to obstruction of blood flow in the lungs. 2. Decreased cardiac output related to increased pulmonary vascular resistance. 3. Anxiety related to perception of difficulty breathing and chest pain. 4. Ineffective tissue perfusion related to decreased oxygenation secondary to PE. 5. Risk for bleeding related to anticoagulant therapy. Management: 1. Monitoring, continuous cardiac and respiratory monitoring. 2. Oxygen therapy to correct hypoxia. 3. Anticoagulation, the cornerstone of treatment, including drugs like heparin, low muscular weight heparin, and oral anticoagulants. 4. Thrombolytic therapy used in massive PE to dissolve clots. 5. Surgical embolectomy, life-threatening cases where thrombolysis is contraindicated. 6. Inferior vena cava filter inserted in patients who cannot take anticoagulants to prevent further emboli. Treatment: 1. Immediate stabilization, oxygen, intravenous fluids, and vasopressors for shock. 2. Anticoagulation, heparin followed by long-term oral anticoagulants. 3. Thrombolysis for massive PE with cardiovascular compromise. 4. Surgical intervention for patients who do not respond to medication or have contraindications to anticoagulation. 5. Long-term management includes anticoagulant therapy and lifestyle modifications to prevent recurrence. Psychosocial medicine. 1. Anxiety and fear. PE is often unexpected and can lead to significant emotional distress. To patient education, understanding the importance of long-term anticoagulation and prevention strategies can reduce fear of recurrence. 3. Social support, family involvements and community resources can help manage recovery and mental health. Prevention. 1. Compression stocking help prevent DVT, especially in hospitalized patients. To early mobilization after surgery or during long travel. 3. Prophylactic anticoagulation in high risk individuals. Example, post surgery. For lifestyle modifications, smoking cessation, weight management, and regular physical activity. In conclusion, pulmonary embolism is a serious condition that requires prompt diagnosis and treatment. With appropriate management, the risk of complications can be minimized, and long-term outcomes are often favorable. Prevention strategies, particularly in high-risk individuals, are essential to reducing the incidence of PE. Effective nursing care, medical treatment, and patient education play critical roles in managing both the physical and psychological impact on PE. Thank you. Have a nice day.